Words I would use to describe mental illness are challenging, difficult.
But maybe not directly, but indirectly it's something that everyone has to work to overcome. And it's hard to overcome, but it's possible to overcome.
This as a serious problem that certain people develop through whether that be their own body producing it, like a chemical imbalance, or stress-induced, or I think it can be caused by many different things. I also think it's a very serious problem that's arising more in our generation than it has in the past.
Something that affects like how people, like a person interacts with someone else, or how like they go throughout their daily life, and it's hard for them. So.
If my friend began to distance themselves due to mental illness, I would reach out, and if they didn't want me to reach out, I would talk to a trusted adult or friend, mutual friend, and see what we can do to help them.
I would reach out to them and tell them that I'm there for them and help them and ask them what they need help with.
I would try my best to help them. Like, I wouldn't allow themselves to distance themselves from me because it wouldn't be beneficial to them, and I would do my best to either help them, whether if they just need to come and talk to me or if they need to go to someone professional to figure out what's actually going on.
I would try to talk to them as much as I could, but I know like they would kind of push me away, so I would like go to someone I was close with or they were close with, and we would try to like team up and help them like get better.
I think it presents itself in different ways with every person. It depends on what activities they're involved in, what kind of things they do with their lives, but it can be in many different ways, whether it's interactions with people or the words that they say or just like the things that they do and the friends that they have and keep and lose.
Just like in the previous question, people might just be distancing themselves and kind of bury themselves in their own little hole, and they think that's the best way to handle it. Or I think it can present itself through maybe acting out or just a change in their personality, maybe something's different, something's going on at home. I just think it can present itself in different ways.
It presents itself as something where they're like distracted or depressed and they can't go out their daily lives like normally, and like something's always on their mind.
Mental illness can affect friends' school or sleep by lack of focus, lack of communication, very little sleep or too much sleep.
School-wise, I think it would definitely cause a negative effect in school because it becomes a distraction and it takes away from their focus, from their grades.
It affects friends in the sense that like it shows you who your real friends are and also can make you not be friends with people because of how you feel or how they feel.
I mean, sleep is insanely important. Like, we all know that. And taking away from that, I think could actually worsen the mental illness because once you're losing sleep, it already takes a toll on your mental stability, along with the mental illness just could cause some serious problems.
It affects school by them not being able to focus, or them just like not doing their work because something else is on their mind. And then with friends, it's hard to like they don't communicate with them, which also makes it hard. And then sleep is they either sleep too much or not enough.
Sorry.
Mental illness is something that is neglected in our society and needs to be focused on more from every aspect of society, whether it is the government helping people or friends to friends helping people or parents to children or students to other students, but it needs to be addressed and not like pushed away and pushed under the carpet, and it needs to be brought into the open.
I was diagnosed with ADD at the age of 4 or 5.
I am diagnosed with depression and general anxiety.
I am diagnosed with severe anxiety.
I was diagnosed with anxiety.
In 5th grade, I was diagnosed with anxiety, and in 8th grade, I was diagnosed with depression.
I was diagnosed I want to say officially where I was on medication in October, I believe.
I was officially diagnosed like 6 months ago, but I've definitely had it for forever. Yeah.
ADD, it just, you forget a lot. You have a hard time paying attention. And when a lot of things are going on, you can only focus on one thing.
Every day, as long as I'm taking my medication, it's pretty normal. I have ups and downs like anyone else. If I forget to take my medicine for like 2 days in a row, then I get pretty down.
Well, before I was on medication, I was a very tense person. I had all these aches and pains just because my body was always very congested. You know, I played baseball and had a lot of shoulder problems because of how tense I always was.
So I've been dealing with anxiety for longer than I can even remember. So I don't even remember like what life was like before like I had irrational fears for stupid things and like, but honestly like it's been so long that I strive to like, I use it like to my advantage. Like I strive to like challenge myself and get out of my comfort zone, whereas the depression kind of like counteracts that, I guess, a little bit sometimes, so it's tough.
Like a perfectionist, but you know, like an OCD perfectionist. I don't know. I have a very short temper sometimes too, but only my parents really saw it.
When I get home, if I have nothing to do, I have like homework I could be doing, but I feel super stressed and just like can't concentrate on anything or like focus on anything other than the fact that like I'm anxious.
Sometimes it is hard to get out of bed and go hang out with people. I have to force myself to go out and do stuff, but then forcing myself to do it actually makes me feel better.
I just seem to, unfortunately, before I was on meds, now I'm fine. I had a very short temper with my parents, which wasn't really fair to them, and I didn't even realize like I did that. Like I was me at, you know, social life me, and then me at home. There was two different kind of versions.
Family life, all my family was diagnosed with anxiety, and most of them have depression, so they're super comforting and supportive, and yeah, I feel safe there.
It's hard for them to get used to because sometimes it just happens out of nowhere and like it's hard for people to understand.
School is rough. Homework sucks because if you're feeling really depressed and down, you don't want to do anything, you kind of are just stuck there. And then the anxiety goes, but you're gonna miss out on points, you're gonna get a bad grade, and then you feel down about that. And so it just goes back and forth.
It makes it really hard for me to like put myself in situations or like kind of push myself to like do better because I don't really want to go out of my comfort zone.
My school life, paying attention in class, sometimes I'll get bad grades because I don't know what's going on.
Like I kind of denied it for a really long time. I didn't think it was an actual thing that I had. I felt like it was just me being, like, trying to be the best person I possibly could be.
Some days I have really great days, and I feel great, and I'm ready to like take on all these challenges and like make the world a better place. And then some days I don't even want to get out of bed, and yeah, like most of my sick days for school are just like mental health days, honestly.
Anxiety is a real thing. Like, even if you try to deny that you don't have it, yes, there are milder symptoms of it. Yes, there are more extreme symptoms of it, but a lot of the times you don't even know you have it until it takes somebody else to kind of really, you know, just pull you out of it, you know?
It's livable. Like, you can live with it. It's not what everyone thinks it is.
Anxiety who don't have it, or like it's easy to like think that people are like being ridiculous. But I think it's helped me to be more understanding of people.
I think I do see myself differently. Like you feel more of like an outcast, but then when you find other people that do have a mental illness, then you feel like better and a part of more, so you see yourself more normal.
So just don't be afraid to like have people reach out to you. Don't shut them out. Like kind of think about it first and be like, am I really myself lately? And Because if you're not, it does help to get some help. So.